Hi everyone, welcome back to VetEcho, your engaging vet student podcast. We are with Jade.
Hi.
And Margot.
Hey.
First of all, happy birthday to us.
Yay!
It's been a year since we started this project, so do you want to say something?
Yeah, sure. Well, first of all, happy birthday to us. And I wanted to say that it's been an amazing journey since we started this project a year ago. And it has honestly helped us broaden our knowledge and see things from perspectives we probably wouldn't have explored on our own. We've learned so much along the way, not just from our research, but also from the conversations we've had between us and with our guests. And, well, speaking of guests, of course, we really like to thank our listeners for their support and our guests for their time, trust, and their interest in what we're building.
Yeah, and I absolutely agree. Thank you to everyone for supporting this project. And of course, we really hope to keep this momentum going and continue bringing you meaningful episodes. And we already have some excited surprises for the next season, so it's going to be a very promising start.
Yeah, keep watching. So today we will talk about complementary medicine in vet field. But before diving into this, girls, do you know what complementary medicine is?
Well, yes, I think complementary medicine refers to practices that are used alongside conventional medical treatments. They are not intended to replace standard therapies, but rather to support them by improving overall well-being and sometimes helping to optimize treatment outcomes. They can also play a role in a more holistic, personalized, and patient-centered approach to care. However, I think that their effectiveness can vary, so they are usually considered as supportive rather than primary treatments.
I fully agree, and I have the same definition. And I also think it's very important to insist on what you said, Jad. If it's used outside of global medical care approach, which means without conventional medicine and that it can really delay diagnosis and treatment or potentially hurt the patient too. So it can put its health at risk.
Yeah. In your opinion, what's the difference between the complementary medicine and the alternative medicine?
Well, to stay simple, I will say that complementary medicine supports standard medical care, while alternative medicine tend to replace it.
Yeah, exactly. So among the practices considered complementary medicine are phytotherapy, osteopathy, physiotherapy, homeopathy, and acupuncture. However, when these practices are used as the sole treatment rather than alongside conventional medicine, they are considered alternative therapies, as Margot said. So since we could not discuss all of these techniques today, we decided to focus on acupuncture. Indeed, acupuncture is playing an increasingly important role in integrative veterinary medicine, acting like a bridge between conventional Western medicine and traditional therapeutic approaches. Rather than being a simple alternative to conventional medicine, it's increasingly regarded as a complementary tool that fits into a global and individualized approach to patient care. Its growing use is mainly linked to its role in multimodal management, particularly in chronic pain rehabilitation and supportive care. In this context, acupuncture may enhance the effects of conventional treatment and contribute to improving the animal's quality of life. So, let's start by looking at its origin. The history of this practice dates back some 3,000 years and is closely linked to Eastern philosophy, particularly Chinese medicine. One of the oldest texts, the Wang Di Nei Ting, or the Yellow Emperor in her classic, written around the 3rd century before Christ, already documents this knowledge. And in veterinary medicine, the earliest records appear between 947 and 928 before Christ, initially focusing on farm animals such as horses, cattle, and pigs. This practice is based on a number of key concepts, namely the qi, represented by the vital energy that animates living beings and circulates throughout the body. It sustains vital functions such as blood circulation and the regulation of the organs. According to the traditional Chinese medicines, health depends on the circulation of this energy, and any stagnation or blockage is seen as a source of pain or illness. Then there are the meridians. There are the channels through which the qi and the blood circulate. They form a complete network connecting the body's surface to the internal organs, thus creating an organic whole. There are generally 14 main meridians, 12 associated with the organs, the tongue, fu, and 2 central vessels, the governor and conception. And finally, there are the acupuncture points themselves, known as shu shui. They are a specific site located along the meridians and constitute the access points to energy. Anatomically speaking, they correspond to areas where the nerves ending, arterioles, venules, and lymphatic vessels converge. They are physically distinguished by low electrical resistance and high conductivity. And these metaphorical concepts have now been translated into scientifically validated neurophysiological mechanisms. And the approaches is no longer limited to energy flow, but focus on stimulating the nervous system. And in terms of mechanism, the insertion of the needles causes a local microinflammation, which stimulates the nerve and triggers the release of bioactive substances. We also succeeded in categorizing the level of analgesia. And in your opinion, what might these levels be and what do they affect?
In my opinion, I think the different levels is, well, the first level might be like in the tissue, a tissue response. Then a higher level can be like the spinal cord and the nervous system in the body. And the higher level for me might be in the brain directly.
Yeah, exactly. That's that. And those spaces have names. So for the tissue response, this is the local analgesia. And then for the spinal cord, this is the segmental one. And about the brain, this is the suprasegmental.
Okay.
So girls, are you familiar with techniques that complement traditional acupuncture using dry needles? And if so, can you tell us a little about them?
I think, I know about like moxibustion.
Yeah.
And it's actually more of a traditional technique since it has been used for a long time alongside acupuncture, and it involves heat stimulation of acupuncture points, and it may influence visceral pain, gastric motility, or inflammatory response through sensory afferent pathways. And I saw that it also studied in the combination with electroacupuncture.
Yes, and about electroacupuncture, I've seen it's one of the best-known modern techniques. In this technique, a mild electrical current is applied through the inserted needles. Compared with manual acupuncture, which can activate both myelinated A fibers and unmyelinated C fibers, low-frequency electroacupuncture mainly stimulates A fibers. It is widely used in pain management, especially for chronic pain, and some studies suggest that it may also help regulate inflammation, for example, by activating the vagal adrenal axis and reducing excessive cytokine response. Another technique is TEAS, which stands for transcutaneous electrical acupoint stimulation. Unlike electroacupuncture, it does not involve needles insertion. Instead, electrical stimulation is applied on the skin over acupuncture points. And depending on the frequency and intensity, it can target different nerve fibers. At high frequency and low intensity, it mainly stimulated A fibers for a more local analgesic effect, while higher intensity stimulation may activate more the C fiber too and engage the brain's descending inhibitory pain pathways. I've seen also other techniques that are a bit less common. For example, the bee venom acupuncture, where bee venom is injected into acupuncture points. The aim is to reduce pain transmission toward the spinal cord by modulating the excitability of neurons in the dorsal root ganglia. However, this technique must be approached very carefully, especially in animals because of the potential risk of allergic reactions or local inflammatory responses. And a more experimental approach is papupuncture, where an enzyme called prostatic acid phosphatase, or PAP, is injected directly into an acupuncture point. PAP can generate adenosine locally and for a longer period of time. And since adenosine has natural analgesic properties, this could theoretically provide a longer-lasting pain relief effect than classical acupuncture, but it remains more experimental and it's not a routine veterinary technique.
Okay, thank you. You have a really wide range of techniques. And I want to come back a little about the electroacupuncture. So I've seen it could also treat neurodegenerative disorders, but not many studies talk about it. About the advantage of these techniques is also that it is more objective, reproducible, and faster than the more traditional way. And I've also seen that the laser acupuncture is a new kind of technique. This use a light beam to stimulate the body energy points without the use of the needles this time. And as it is painless, it is preferred for young, timid, or stressed animal, for all animal species. So now let's talk a bit more about the mechanism that the insertion of the needle triggers. So, girls, do you have any idea that what this stimulation triggers?
Well, from what I've read, acupuncture stimulation triggers a complex cascade of neurochemical and biochemical responses. For a neurochemical perspective, needle stimulation can promote the release of endorphins in the cerebrospinal fluids, which is considered an important central mechanism involved in acupuncture's analgesic effect. Locally, acupuncture may also stimulate mast cells, leading to the release of serotonin and histamine. And at the same time, local nerves ending can release substance P, which increase the sensitivity of afferent nerve fibers to the stimulation.
Yeah, and from this pause, these peripheral events initiate short-lived neurogenic inflammatory signal that serve as a trigger for the downstream modulation.
And also for the biochemical perspective, the mechanical pressure created by needle can activate the TRPV2 channels on mast cells. This may trigger the release of extracellular ATP, which is then hydrolyzed into adenosine. And adenosine can bind to A1 receptors and help inhibit pain signals.
This local biochemical signaling is then integrating into a broader enzymatic cascade, including the activation of the factor 12, which leads to the formation of kinins and prostaglandins, reinforcing vascular and immune responses at the site of the stimulation. Do you want to add something, Hajat?
Yeah, well, to sum up and facilitate things for our listeners,
Yeah.
I think, if I understood well, all of those processes, neurological or biochemical, leads to one big concept, which is called the gate control theory, and it's basically the blocking of transmission of pain signals.
Yeah, exactly. Nowadays, the acupuncture is no longer seen as an outdated practice, but rather as an integrative discipline validated by modern technology and knowledge. And I have a few examples for you. The use of functional MRI, which measure the brain activity by detecting change in blood oxygen levels, has shown that stimulating specific points activates precise area of the brain linked to pain management. And on the pharmaceutical side, the acupuncture can be used to compensate for the limitation of conventional treatment, notably by reducing dose of non-steroidal anti-inflammatories and minimizing their side effect. Finally, organizations such as the WHO and the National Institute of Health I've officially recognized its effectiveness for musculoskeletal pain and osteoarthritis, facilitating its inclusion in the modern clinical protocols.
Okay, that's interesting.
Yeah.
Now that I have a trick question for you. Do you know some kind of use of acupuncture in veterinary medicine?
Well, yes. I think in veterinary medicine, acupuncture is mainly used as a complementary tool within a broader therapeutic and rehabilitation approach. And these indications that I'm going to explain are supported by veterinary acupuncture organizations such as IVAS, the International Veterinary Acupuncture Society, and are also described in studies published in veterinary journals like the Journal of the American Veterinary Medical Association, and the Veterinary Journal. So if our listeners are interested, they can also look into these organizations and publication for more information. But, first, in physical rehabilitation, it is often integrated into post-injury or post-surgical recovery programs. And in this context, acupuncture can be used to support tissue healing, improve local blood circulation, and help reduce muscle tension or discomfort that may limit movement. And it's usually combined with other rehabilitation techniques, such as physiotherapy or controlled exercise. And the goal here is really to help restore function and improve recovery outcomes over time. Also, in neurological disorders, such as intervertebral disc disease or cases involving paralysis, acupunctures can be used. And the idea here is to stimulate peripheral nerve pathways and support neurofunctional recovery by modulating nerve activity. And it helps to support neurological rehabilitation and improve clinical progression in some cases.
Yeah, and about that, I have also seen it's used in vestibular syndrome, for example, as a complementary therapy. In this case, acupuncture may help support recovery by stimulating sensory and neurological pathway involved in balance, posture, and coordination, for example. It may also help reduce discomfort, nausea, muscle tension, as you said, Jad, and secondary pain caused by abnormal head posture or difficulty of moving. And also I've seen it's quite used, and I think it's one of the main use of acupuncture today, which is chronic pain, especially in cases such as osteoarthritis, for example. And in this case, acupuncture can be considered as a complementary therapy to help reduce pain perception, muscle tension, and compensatory discomfort caused by abnormal posture or reduced movement. And as a result, some patients may move more easily, tolerate rehabilitation better, and show an improved of quality life too.
Yeah, sure. And also, I saw that acupuncture can be used for behavioral issues such as stress, anxiety, or educational problems, but I do not know if there's real scientific evidence for this utilization.
Well, I don't really know about it, but it's interesting. And I think that you've mentioned main of the uses, but I would like to add maybe gastrointestinal disorders, for example, for nausea and the motility. And for example, in the equine emergencies, we can use the acupuncture for colic and intestinal impactation. Next, we can have for some respiratory disorders, but this is really depending on the case. Also for horses, we can help for the treatment of COPD or HIVs and the exercise-induced pulmonary hemorrhage. We can have also some others indication that are less common, like endocrine disorders, dermatology, urogenital, renal failures, ophthalmology, or ENT for ears infections, for example. But this is really depending on what the conventional medicine can do and if it's appropriate to use acupuncture here. And for a really big reminder, the acupuncture is not a substitute for the essential treatments. So let's see now more in detail at the scientific evaluation of acupuncture. Although it is constantly advancing, these evaluations still face several significant methodological challenges. The first concern of the standardization of studies, and the acupuncture is based on an individualized approach in which the choice of point and stimulation are tailored to each animal, its clinical condition, and the progression of its condition. The flexibility, which is an integral part of the practice, runs directly counter the logic of standardized protocols in conventional medicine, and therefore makes studies more difficult to replicate in exactly the same way. In your opinion, what can be the other limiting factors of this practice?
In my opinion, another limitation might be the lack of comprehension of some mechanism of action. We already talked about the cascade and what the physiological response, but what we still don't understand is how acupuncture points in the forelimb, for example, can impact specifically the gastrointestinal motility or something like that. So we know about the physiological response, but how does it affect one system specifically and not every system? Well, that's that kind of mechanism that are not completely understood and clarified, and I think it can make it more difficult to fully integrate it into evidence-based frameworks.
Yes.
And another limitation for me is the variability in its acceptance within the veterinary field. Depending on the clinical setting or the country, acupuncture may be more or less accepted and integrated into conventional practice. So as it's not widely spread, it can limit the studies and the money to do the studies.
Yeah, exactly.
The funds.
Yes, thank you. That's the word I wanted.
What you said, I really agree with that, and I had other things that I've seen. First, it's the placebo and body attention paradox. It can be very difficult to separate the specific effects of the needle from the effects of simply focusing attention on a part of the body. Some research suggests that even paying attention to an acupuncture point without real needle stimulation can trigger brain responses that are close to those observed with acupuncture. And this makes it very challenging to design a perfect placebo group. Another limit that I've seen is the neuroanatomic variability, as you explained a bit, Irina. But what I wanted to talk is the fact that acupuncture effects may depend on the presence of very specific sensor neurons, and these neurons are not distributed equally throughout the body. Research led by Qiufu Ma in 2021, published in Nature, showed that some anti-inflammatory effects of acupuncture are possible only in area where neurons expressing the PROKR2 CRE receptor are present, and these neurons are abundant in the lower limbs, for example, but almost absent in the abdomen. So this helps explain why stimulation at one point may produce a stronger effect, while the same type of stimulation in another body region may fail. And that's also make difficult creating generalized studies. And there is also another important difference between manual acupuncture and electroacupuncture, for example, which block the transposition of certain results in one or the other. We have seen before that manual acupuncture activates both A and C fibers, while low-frequency electroacupuncture mainly targets A fibers. So this means that electroacupuncture does not perfectly reproduce the neurological effect of traditional manual manipulation, especially the complex sensory experience known as Deki. Therefore, results obtained with electroacupuncture cannot always be directly applied to manual acupuncture. And finally, as you said, Irina, there is an individual variability.
Yeah, of course.
Patients do not all respond the same way to the stimulation. Their baseline tactile sensibility, neurological profile, pain thresholds, and even stress level can influence how strongly the brain will react to acupuncture.
Yes, I have also some other factors. For example, the heterogeneity of veterinary studies that often involving a small and highly varied population, whether in terms of species, breed, morphology, and disease progression. So this will introduce significant variability in the results, which complicate statistical interpretation and the comparison between studies. And there is also a methodological limitation. For example, the double-blind studies are complex because it is difficult for both the practitioners and the owner to remain completely unaware of the procedure. The so-called sham acupuncture protocols, where needles are inserted to mimic a real session, but without stimulating the acupuncture points. I'm not sure exactly of how it works, but this exists.
That sounds complicated.
Yes. And the sham acupuncture is used as a placebo, but it remains controversial as it is difficult to guarantee a complete absence of physiological effect. So, despite all these limitations, several studies and literature's reviews suggest that acupuncture has genuine value in the multimodal management of pain. It is increasingly being incorporated as a complementary tool in protocols combining drug treatments, rehabilitation, and lifestyle management. However, its efficacy must always be interpreted with caution, as it depends heavily on the clinical context, the quality of the studies, and the patient selection. And now let's talk a bit about the security, the risk, and the limits. So, as it is generally considered as a safe technique when practiced correctly, unlike some long-term drug treatments such as the NSAIDs, which can cause kidneys or liver side effects, acupuncture has very few adverse effects. However, although serious complications remain rare, certain risks do exist and must be taken in account. So, in your opinion, what are the main risks?
For me, there's 3 main risks associated with acupuncture, and they are mainly related to the technique, the hygiene, and the anatomical precision. So the first risk is related to the improper use or overuse of the technique. If acupuncture is not correctly indicated or is used instead of appropriate conventional treatment, it may delay diagnosis or effective medical management, which can negatively impact the patient's outcome. Second, the hygiene and infectious risk. If the needle are not properly sterilized or if aseptic conditions are not respected, there is a risk of local infection at the insertion site, and in more severe cases, even systemic infection. And my final point is the anatomical precision. So if the practitioner does not have a perfect knowledge of anatomy, there is a real risk of inaccurate needle placement, and acupuncture requires real precision. If the needle is inserted in the wrong location, it can potentially stimulate or damage structures such as nerves or blood vessels, leading to unnecessary pain or complications.
I agree. And when you mentioned that even dry needles can create adverse reaction, it made me think about other acupuncture-related techniques. From what I've seen, traditional dry needles acupuncture is often described as having few serious adverse effects when it is performed correctly. However, some modern techniques introduce additional factors that may increase the level of risks. For example, bee venom acupuncture, which may lead to toxicity, strong local inflammation, or allergic reactions, as I said earlier. So it's something to consider when you want to do this type of techniques. And other techniques such as injection-based acupuncture or electroacupuncture also require specific training and careful patient selection. So even if acupuncture is generally considered safe, its safety really depends on the technique used, the practitioner's expertise, the patient condition, and the clinical context in itself.
Yeah, exactly. And it is therefore essential that the practitioners take the time to put the animal at ease and the session takes place in a calm environment. And also the appropriate restraints is also vital, both to ensure the safety of the staff and the owners, and also to properly observe the animal's reaction to prevent accidents. The acupuncture remains a complex medical discipline requiring specific skills. It is therefore strongly recommended that the vets undertake comprehensive accredited training to acquire the knowledge necessary to correctly assess the patient's state of health and develop appropriate treatment recommendation. And the success of the treatment therefore depends on the practitioner's ability to establish a precise protocol, the choice of the points, the depth of insertion, and also the type of simulation. And it is based on a very rigorous veterinary diagnosis. So we've already just mentioned the formation and the ability of the practitioner. So let's dive into it. The veterinary acupuncture requires specialized training, as it is a complex discipline that demands both a solid medical knowledge and technical proficiency. Recognized organizations such as the International Veterinary Acupuncture Society or the Chi University offers accredited training courses enabling vets to acquire the necessary theoretical and practical foundation. Those programs generally combine a traditional concept of Chinese medicines with modern neurophysiological knowledge in order to enable a rigorous therapeutic approach tailored to each patient. Training plays an essential role as it determines the practitioner's ability to correctly assess the animal's state of health, select the appropriate acupuncture points, as was said, and adapt the technique used. Do you think it is essential to be a vet to practice animal acupuncture?
Well, I don't know if it's necessary, but it's important. I think with a great formation, but you need to have like a real knowledge of the anatomy and everything like that. So if you're not a vet, the formation needs to be really like perfect.
And I also do think we talked about the fact that it's often used as a complementary medicine.
Yes.
And this fact is for me very important in the sense of it needs to include a follow-up by a vet, by a professional that is able to identify the condition of the animal and to really manage it and understand when acupuncture has a role to do.
Yes.
And when the traditional conventional treatment needs to step up. And for that, I do think it's,
better?
For me, it would be maybe safer in the first time to have these two approach in one professional. But I don't really know if there is regulation on that, which can be interesting to know. And if there is not, I also think it's possible, but the professional, the acupuncture professional, needs to really work with a vet professional to have a complementary and collaborative
view, like
treatment.
Yeah.
And I think it's like quite like the other complementary medicines, such as osteopathy, for example. And if you're interested in this subject, we can also make an episode about it. But some professionals of like complementary medicine are not veterinarians, and they are trained in specific courses. And the risk here is that there can be a bias on each side. For example, veterinarians could underestimate complementary medicine, while the other practitioners could overlook the effects of complementary medicine and thus miss the importance of a vet follow-up.
Yeah, exactly. And to answer to Margot for your question about the legislation, it varies from country to country. In many countries, the veterinary acupuncture is considered a veterinary procedure and must therefore be performed by a trained vet, whilst in others, certain procedures may be authorized for non-vet under certain conditions. And for example, in France, it's mainly a vet that can do acupuncture, but a non-vet can also do it, but it's mandatory that it's done under vet supervision.
Okay.
So this regulatory variability underscores the importance of recognized training and supervised practice in order to ensure safe, consistent care that it is integrated into the animal's medical management.
That's interesting.
Yeah. I have a little suggestion for you. If you want, I will give you 2 cases, and it's up to you to tell me in which one the use of acupuncture is the most appropriate.
Okay.
So, case 1. A dog is presented with acute lameness in the hind limb, accompanied by severe pain and a suspected cruciate ligament rupture. Do you want the case 2 now?
Yes.
Okay.
So have a better comparison.
So the case 2, an elderly dog present with a chronic hip osteoarthritis, moderate pain, and reduced mobility. Despite anti-inflammatory treatment, the animal remains stiff upon rising and exhibits persistent locomotor discomfort. For you, who need acupunctures?
No one. Just kidding. No, I have my idea. I think it's the second dog, and I will say it for 2 reasons. The first one is because in the first case, we have a dog with acute pain.
Yeah.
We don't know if it's managed by other treatment that could be more efficient for a first intention. And the second point, I think, is it's not really. We have supposition on what he has, but we don't have a real diagnosis.
Yes, exactly.
So I do think it's important first, before planning a complementary medicine, to first diagnose correctly and stabilize the animal as we can.
Yeah.
For the second animal, the second cases, I would say it's more appropriate because in this case it's the opposite. We have chronic pain that is already managed by certain drugs.
Yes.
And also we have an animal that has a real diagnosis and a follow-up.
Yeah, exactly. Congrats.
Yeah.
You got it.
I'm ready.
Yes. And to come back a little bit about the case 1, although acupuncture might help to temporarily relieve pain, it does not indicate that it will not correct the joint instability or the mechanical cause of the lameness. And as you said, the priority here remains an orthopedic diagnosis and also an appropriate surgical or orthopedic management. So this wraps our episode. And to conclude, acupuncture in veterinary medicine should be regarded first and foremost as a complementary tool rather than a universal solution. Its main benefits lies in the management of chronic pain, particularly as part of a multimodal approach combining drug therapies, rehabilitation, and holistic care of the animals. However, despite its increasingly widespread use, it still requires further standardized studies to better define its indication, its actual efficacy, and its limitation in practical practice. So, thank you for watching this episode. If you found the topic interesting, please subscribe, like, and share the video to support the project and make sure you don't miss the future content. If you want to know more about this subject, we will put all our studies in the description. See you next month for the new episode. Bye.
Bye.
Bye, and without the needles.
Yes.